question number 1, a 30-year-old man presents with fever, malaise, and severe pain in his right wrist and left knee for the past 2 days. He describes the pain as 8 out of 10 in intensity, sharp in character, and extending from his right wrist to his fingers. He denies any recent inciting trauma or similar symptoms. His past medical history is unremarkable. He's sexually active with multiple partners and uses condoms inconsistently. The vital signs include a blood pressure of 120/70, pulse of 100 per minute, temperature 101. On examination, the right wrist and left knee joints are erythematous, warm, and extremely tender to palpation. Both joints have a significantly restricted range of motion, and a petechial rash is noted on the right forearm. Arthrocentesis is performed of a left knee joint. Which of the following would be the most likely finding in this patient? So would the aspirate show gram-positive cocci in cultures? Would it show minimal purulent joint effusion with negative cultures, positive ASO? Would radiograph show osteopenia and joint space narrowing, or would the aspirate show negatively birefringent crystals under polarized light? It's a pretty straightforward question if you know the clues that you need to pick up on. So he had severe pain, he had swelling, it was erythematous, warm, extremely tender, and the biggest clue here was to note that he had a rash as well. So I think that's the clue that would kind of lead you to your answer here. So this patient, and another clue to pick up on was his high-risk sexual behavior. So joint pain, high-risk sexual behavior, and a rash. All of this should give you enough clues to come to this answer. So disseminated gonococcal infection presents as a triad of asymmetric polyarthritis, tenosynovitis, and dermatitis. Okay, it's really important to know this association and this triad. DGI has the triad of asymmetric polyarthritis, tenosynovitis, and dermatitis. It can also present as an isolated monoarticular septic arthritis. Pregnancy, recent menstruation, lupus, and immunodeficiencies are the biggest risk factors. This patient has high risk for STIs due to the history of multiple sexual partners, inconsistent use of condoms, and his presentation of polyarthritis, painful tenosynovitis of the hand, fever, malaise, and a petechial rash. All of this is consistent with disseminated gonococcal infection. So the arthritis here, it can be mono or polyarticular with pain, swelling, and a purulent effusion with increased WBCs on the joint fluid, typically more than 50,000. The synovial effusion, though, may be minimal and cultures can be negative. So if so, then nucleic acid amplification test may confirm the diagnosis. So that depends on the amount of effusion, which is usually pretty low. The important takeaway points from this question are the triad, the fact that it can also present with just an isolated monoarticular septic arthritis, the risk factors, the high-risk sexual activity is putting the patient at risk for this, and the fact that you get very minimal effusion, but you get a high volume of WBCs in the effusion. Okay, so that is why this is DGI. Coming to some of the other options, some of these would be obvious. This is not a typical gout presentation. The negatively birefringent crystals are seen in gout, very characteristic. I'm sure you all know this by now, but it has a very different presentation. There wouldn't be a rash, different joint involvement would be present. Osteopenia with joint space narrowing, this is rheumatoid arthritis. That's nothing like what this patient would present. Positive ASO titers are seen with streptococcal infection. And Staph aureus is probably the only other clue, only other option, which is kind of close to our differentials. But you wouldn't see the rash with streptococcal infection. And another thing is that staph infections. And staph infections are usually monoarticular. You won't see any tenosynovitis or dermatitis. So if you pick up on all those little clues that you're getting in your question of the rash, of the tenosynovitis of the right wrist, the arthritis, that would help you reach your answer.
Thanks for watching. Please give a thumbs up and subscribe for more.